Hey guys, I'm Dr. Andrew Jones, and today I'm going to tell you how you're not protected by COVID-19 wearing all of this. I wore all of this from day one, January, taking care of COVID patients, and I still caught it. So let me tell you how you are not protected wearing all of this. Whew, it's a lot of stuff. All right, the gloves. Man. Whew. All this stuff and still I caught COVID, I tell you. All right. Basically, I'm going to tell you why, even though I wore all of that protective personal equipment, I still caught COVID, and why you should not be surprised if you catch it, and so forth. Basically, wearing the gloves, it will protect you from contact, but what happens a lot of times, and I've seen so many times, people will wear their gloves, they go into the gas station, they pump the gas, they pay for it wearing the gloves, they come out, get into their car with the gloves, they get in, and then they keep the gloves on and they text and drive and drive with the gloves on, and it's just you're cross-contaminating everything, so you defeat the purpose of the gloves. Basically, with the protective equipment that we wear, they some articles swab the personal protective equipment and found that there's nothing to show that COVID is actually on the equipment that we're using. So it makes us wonder if wearing it actually is protecting us. And as far as the face mask goes, the virus is spread so many ways. Airborne, contact, even one thing that's going to surprise you is aerosolized. It's found in the sputum and feces. So when you go to the bathroom and have a bowel movement, you flush the toilet, you aerosolize the virus into the air. So you walk into the bathroom and you breathe. I mean, not trying to gross anyone out, but yes, that is a way to catch COVID. The COVID is like a thief in the night. Like, a thief can go into your house, he can go in the back window, the front window, the attic window, the basement window, the front door, the back. There's so many ways that this virus is contagious that focusing on the face mask and this equipment is going to help you, but in the long run, it's not going to protect you 100%. These cloth masks that people are wearing, they're stylish, they logos and things on them, actually from the research, only blocks up to 20% of the particles. So you have 80% of the particles coming in. Surgical mask, up to 60%. But the problem is people don't wear these masks the right way. They put them on, they do this, they adjust it, they do this for a second, they do that, they eat, they drink water with the mask and so forth. Actually, the one thing that's going to surprise you wearing a surgical mask, you see how the creases on the side are right here? Air flows in the path of least resistance. So while you're walking and breathing, air sucks in through the side. So even though you're protected up to 60-70% this way, it doesn't matter because air flows in this way. So it's pretty much this surgical mask is useless. And I'm sorry to say that, but from the front, yes. But what good is it to lock your front door for a robber and he comes in through the back door? The robber still got in. Same thing with this. What good is it to block air this way if it still comes in through the side? The virus still gets in. And the N95 that people wear protects you 95% and blocks 95% of particles. It doesn't do that with the regular person because these masks have different sizes. It's not one size fits all. So you have what's called a fit test in the hospital. You put the mask on. It has to be adjusted the right way. You have to press down here to get more seal, and they put a shield on top of you and they spray a mist. If you can smell it, then that's not the right size N95 for you. If you can't smell it, you have the perfect N95 mask. So everyone out there who buy N95 masks off the street and wear them, they're not protected at all. Well, a little bit, just like the surgical mask. No mask, 0% obviously. This up to 20%, but people take them on and off. Same thing with these, up to 60%, but people aren't consistent. These 95% only if worn the right way. The problem is I see people, they'll wear the mask, they'll go get something to eat, and then they take the mask off. Obviously you can't eat and drink with the mask on. And you have to be 100% perfect. If I was to wear the initial equipment you saw in the beginning, 24/7 every day, then yes, I am protected. And also the face shields that people wear, I'm going to show you something. Right here, I'm protected. Same thing as this surgical mask. When I do this or that, air flows in through the side. So air is still coming in this way. Like when I move to the side, I'm not walking in a straight line that way like that. I'm walking at angles. And when you walk at angles, air flows this way. So again, all of these things are to protect you. Like an airbag in a car. An airbag will protect you, but it won't prevent you from having a fatality 100%. All of these things work if used the right way, but none of them, even used the right way, will protect you 100%. People wearing all of this equipment are still not protected 100%. And people forgot in the beginning, all of the experts on TV and so forth, infectious disease and so forth, they said one thing, and it sticks in my head and I agree with 100%. Trying to stop COVID is like trying to stop the wind. So let's do the social distancing, wear the face mask to slow down the cases to not overwhelm the healthcare systems. They never said wearing this stuff will protect you 100%. They never said that. Even one CDC director said something that was pretty interesting. I'll read it to you. He said, "We have powerful tools at our disposal. Social distancing, wear a face mask in public, and be disciplined about frequent hand washing." Yet, as you guys know, cases are still going up. Cases going up. Everyone out there is blaming everyone. The rioters, the protesters, the anti-quarantiners, the face masks, the COVID party, blaming everyone. But the truth is, from what I said earlier, if you're not protected 100%, then you could have gotten COVID from anything. Taking your face mask, get a drink of water, and you breathe in that air. Like there's so many ways to get COVID. It's impossible, to know where you got it from. What the CDC director said is true in the beginning of a pandemic. If you do these things, which has been documented for decades, you do those things, you can stop a pandemic. And actually, there are countries right now around the world who did those things in the beginning, and they have 0 cases. They're living their lives, kids going to school, they're going out and having dinner in public, eating inside. They have nothing to worry about because they did those things that we're doing now. We're doing these things now, it's too late. The virus is already here. So basically what the CDC director said is true, but he embellished it a little bit because it's too late to do it. We need to do other things on top of that. One of the other biggest things that's hurting us as a country is people walk around thinking that COVID is selective in who it attacks. I can go to Target, Walmart, not to just name them, but there's other big stores beside them that I can go there, wear a mask, but the mom and pop shops, I can't go in there and they stay closed because I can get COVID there, but the big stores, I can't get COVID in the big stores. So that in itself, the whole thing about dining and so forth, okay, well, or grocery stores, you have to be open, So grocery stores, I'm fine. I wear my mask, and I just told you how much you're protected. You're around other people who are breathing in and out, and these particles going in and out these masks, they last in the air for hours. So you have all these people in all of these stores, the big stores, wearing masks like this, they adjusted it, and so forth. Air flows in through the side, and you're breathing in that air. There's so many people, hundreds of people in and out these stores per day. So your chances of getting COVID are actually very high. So basically, it's big stores, little stores. I can walk outside and get COVID. That's not true. Air flows in the random ways. There's this one thing I heard that was so funny. It said that if you're jogging and there's a person in front of you who has COVID and he's breathing out, the air flows in a straight line and you can breathe it in and catch COVID. That's impossible. If anyone who knows basic science and physics, air doesn't flow like that. They're referring to jet streams in the ocean and into the stratosphere. It's not the same. Everything is so disorganized. Everyone is doing what they want. Big businesses is doing what they want. Government's doing what they want. Everyone is making decisions based on feelings. I feel this. I feel if I check your temperature before you come into my place of business and you have normal temperature, you are good to come in. I feel that if I say we're this, you're protected 100%. I feel that if you come into my restaurant or business wearing a face mask, but then later on you can take it off when you're in this area. Air still flows, but I feel that because you have to eat and drink, when you go right there and you take your face mask off, you're fine. I feel this, I feel that. There's no science behind feelings or opinions. So no organized team has ever won a championship with everyone doing whatever they want. No company is successful with all the tiers of employees and supervisors doing whatever they want. No business team or anyone would ever have success with everyone doing whatever they want. And this is another classic case where the whole country, people from the top to the bottom, are doing whatever they want based on opinions. As a result, people are panicking, cases are going up, people are scared, they don't know what to believe. The news is highlighting people dying. It's a big mess out there. And as a result of the panic, proms have been canceled, graduations have been canceled, people's savings have been depleted, and unemployment is actually on a rise and hit record numbers. And as a result, people are losing their insurance because it's been months. Their health insurance because they haven't been working, so they can't get the help. Anxiety and depression have increased by 30%, which have detrimental effects on the immune system. So, and hospital cases are also rising as a result of that, because an impaired immune system means you're more susceptible to being infected. I want to leave everyone with this. Every winter, cold and flu season, 200 respiratory viruses and influenza go through the US. You have 1 billion cases. Now imagine those, and people are dying from that, you know. So imagine 1 billion cases, and then you add COVID-19 on top of that. How this could destroy our healthcare system, the hospitals be overrun. We're not even finished the first wave yet. So the second wave will start this winter. It could be I don't even want to think about it. It could be a catastrophe if this does happen. This is not some hemorrhagic mutated virus that has a mortality rate of 90%. That is going to come if we don't do something right now. This is kind of like a warning shot. Viruses and pandemics have been around for centuries. From the one that we remember is the Spanish flu, the swine flu, which killed 500,000 people, and this one. These have made their mark in history, which should let you guys know that more pandemics are coming. If I just told you how much this protects you, 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 imagine if this was the Marburg virus that mutated, it has a mortality rate of 90%. We're all dead. This will not protect us from the Marburg virus. God forbid the hantavirus mutates and comes out. Remember, Ebola is still out there. Ebola, if it mutates, becomes respiratory, there's nothing we can do. Smallpox is still out there. There's other viruses out there. SARS had a higher mortality rate than this one. MERS has a higher mortality rate. It's still out there. So these are pandemics looming around the corner. Not to scare you, but we need to do better than this. We definitely need to do better than all of this. And I don't mean you, I mean the government and everyone else needs to do better, because if this is all we're going to do for COVID-19 and the cases are as what they are, imagine something with a higher mortality rate. This virus does not warrant the emotional and physical damage it has done already to people who are depressed and anxious, especially the kids who have mental, physical, and social developmental impairments by being at home, not being around the classmates, not interacting. These are lifelong adverse effects that they're going to have the rest of their lives because of this. We need to stop focusing on face masks, who's wearing a face mask, who's not wearing a face mask. Are you social distancing? Wait, you're 4 feet, you're not 6 feet. And actually, that's not true. The virus can travel up to 27 feet. That's just an approximation. It's not exact. So the face masks, the social distancing are great, but let's stop focusing on that. Let's focus on a healthy weight, good night's sleep, healthy diet. People who are in the hospital right now I'm seeing the numbers are going up for obesity. I'm trying to see that a lot. With no health problems, just obese, nothing else. You have a six times chance of being in ICU, which means you're at the tube down. You're not in ICU and talking and eating and drinking. You're in ICU, 6 times likely to be in ICU if your BMI is above 34. And that's more than 60% of this country. Sunlight also kills the virus. So even though the gyms are closed, get outside, go running. The virus has been shown to be killed by sunlight in a few minutes. Go inside, enjoy the fresh air, and be safe.